Thanks, Bob. I'm here at the University of Texas Health Science Center at Tyler, or UT Health Northeast as it's come to be known. This institution has a long history of providing excellent patient care in more than 30 specialty areas like cancer treatment and prevention, along with several physician training programs and world-renowned clinical and biomedical research. But UT Health Northeast is starting a new chapter in its history and addressing one of the most pressing healthcare problems in our region. Dr. Kirk Calhoun is president of UT Health Northeast. We caught up with him earlier today. Dr. Calhoun.
Hi, Jeff.
Can you tell me why UT Health Northeast is starting this new behavioral health initiative?
Well, our state is facing a huge mental health crisis. 500,000 Texans need increased access to public health services, either inpatient or outpatient services. And as a state institution, as a member of this community, we really felt an obligation to try to address this dire situation.
Of those 500,000 Texans in need of behavioral health services, some 85,000 live right here in Northeast Texas. Dr. Jeffrey Levine is the Senior Vice President for Clinical and Academic Affairs at UT Health Northeast. He says area hospitals and clinics are already seeing many of those patients, but not for their mental health issues.
An example, for instance, would be a patient who has chronic medical problems, also suffering from depression. Well, we need to provide a mechanism for primary care providers to be able to readily consult with or to deliver those kinds of services to patients who have depression suffering from a number of chronic medical diseases.
Sherry Buston is the Administrator of Behavioral Health Services for UT Health Northeast. She says the new initiative here will provide immediate relief to a heavily overtaxed system.
We'll have approximately 74 beds. 30 of those are long-term care beds where a patient has a chronic mental illness who needs a longer-term treatment program. And then we have a short-term acute care program. It's 14 beds for persons 18 and up that are suffering immediately from a crisis of mental illness. And then we have a 30-bed Jerry Psych program, and that's 30 beds dedicated to serving senior adults ages 55 and up who are suffering from a mental illness, including things like Alzheimer's type dementia, who have behavioral disturbances or major depression also along with those types of dementia.
Buston says that even though our population is living longer and longer, that shouldn't mean seniors have to deal with depression alone.
With our senior adult population in particular, they're often overlooked, and those persons have a lot of treatable mental illnesses. Unfortunately, most of them are not getting treatment, and the demand is there. And we know that we're meeting a demand here in Northeast Texas by providing those services here at UT Health Northeast.
Even though Northeast Texas has a suicide rate 65% higher than the statewide average, many communities in the region have only one mental health provider for every 25,000 residents. The statewide average is one for every 3,500 residents. Dr. Calhoun says those statistics highlight the dire need for the increased access UT Health Northeast will provide to behavioral health services.
They're important in terms of managing our emergency rooms appropriately. It's important in terms of keeping people out of jails and getting them into appropriate mental health treatment. And it's important if we're going to have a happy, healthy community.
George Roberts leads the Northeast Texas Public Health District. He says new behavioral health initiatives at UT Health Northeast will definitely help relieve the strain on other providers.
We have a lot of folks that are trying to do good works in the field of mental health, but it's tremendously understaffed at this point. So having more beds available is a real blessing for our community. And hopefully, as people get treated with their mental health illnesses, again, they can go back and be productive members of society and not have to end up, unfortunately, in a jail situation.
The new behavioral health programs are a huge undertaking financially for UT Health Northeast, which gets less than 20% of its funding from state taxpayers. Joe Wolkers is the Executive Vice President and Chief of Staff for the institution.
Our funding is coming from several sources. We're utilizing some of our reserves to construct the facility. We're using philanthropy. We've had generous donors who have given us funds to help support this effort. The state it will help pay for the operation of these units. And for the geriatric unit, we'll be looking at third-party payers to cover the cost of the patient's care.
Wolker says the economic impact of those expenditures on the city of Tyler, Smith County, and the surrounding region can't be determined.
Because every time that you spend an actual dollar, there's a multiplier effect. That, for example, people go spend money in the community. We're bringing new people into the community. They're buying houses. They're spending money that wouldn't necessarily be here if these programs weren't here.
Dr. Levine says there's an added long-term benefit to having these programs at UT Health Northeast.
We do currently have a training program for psychology interns that we've had roughly for a little over a year now. And we're looking certainly to sustain that program here on the Health Science Center campus and grow it to some degree as well.
Those 74 beds and outpatient treatment programs are scheduled to be operational by October 1st. About 250 new employees will be added to the more than 1,000 already working here to care for the new patients. Reporting from the University of Texas Health Science Center at Tyler, I'm Jeff Johnson, UT Health Northeast.